The CDC and White House rolling out a plan for many Americans to get a third dose of the COVID vaccine. But one local doctor tells us not everyone is eligible just yet. Eyewitness News reporter Troy Kless explains why.
The CDC's change in COVID vaccine guidance is to be expected.
It's not unusual for any vaccine over a certain period of time to have some waning immunity.
Dr. Brian Alsip, chief medical officer at University Health, saying they are still waiting for data to definitively show when larger populations need a third dose. For now, he says to follow the CDC, who says people who are moderately to severely immunocompromised are recommended to get an additional dose at least 28 days after a second Pfizer or Moderna shot. The CDC says that only represents 3% of the adult population, but Dr. Alsip says for others, don't get ahead of the public health officials.
For example, if you had a vaccine 2 or 3 months ago, and you're not immunocompromised, you still should be waiting until the recommended interval after that second dose before you get your third one.
Dr. Alsip says they're not sure when this could expand to other groups, but their biggest concern remains people who are not vaccinated.
And that's what troubles us most, at least in the hospitals, because they're still represent, at least at University Hospital, about 93% of every patient we have to admit for COVID.
Dr. Alsip urging people to take advantage of the vaccine,
which is really the best protection and probably the best way you can protect your own life.
Troy Kless, KENS 5 Eyewitness News.